Today I'm going to talk about my 4 favorite fillers for lips. I love all these fillers and I individualize it depending on the patient, what the patient's needs and desires are and what I think would look the best. So let's start talking about the 2 working horse fillers. So the 2 fillers I use the most in the lips are Restylane and Juvederm Ultra. The other 2, and we'll talk about these also, are Volbella and Volure. I know there are a lot of names, but we'll go over one by one and take some time on that. So generally when I have a patient come in wanting fillers for the lip, be it male or female, and they just want fullness to the lip, and maybe they want more proportionality to the lip, where they may say, I want the upper lip a little fuller, or I want more of the upper lip showing, or I want less of my gum showing when I'm smiling. So all these patients are eligible for both Restylane or Juvederm. The difference between the 2 is moderate. It is they still belong to the same family of fillers, the hyaluronic acid fillers. So what that means is hyaluronic acid is a sugar that's found in our body, in our skin, that provides hydration to the skin. But the source for hyaluronic acid of these are not human source. They're made in the lab. So generally when someone comes in for fillers, I ask them kind of what their goals are with the fillers. And especially if a patient has never had it done and they are a virgin lip filler patient, then I usually recommend Juvederm. It's a little, it gives you a slightly softer appearance, kind of like a daytime makeup. That means subtler colors, slightly more muted appearance. So same thing with the Juvederm, will give you a softer appearance. And if someone wants a little more drama and a little more dramatic appearing lips, then I recommend Restylane. So they'll still have very nice results, but a little more fullness to the lip and a little more dramatic look. So it really depends on what the patient's end goals are, depending on the Juvederm Restylane. Post-op, the Restylane does tend to swell a bit more than Juvederm. So that means the first 48 hours you will have significant swelling, and certainly more with the Restylane than with the Juvederm. Both of them swell, but much more the Restylane than Juvederm. And by about 10 days to 2 weeks, all the swelling will be gone and you'll settle to what you're going to finally have. And if you love the results of your lips in 2 weeks, then a good follow-up would be in approximately 6 months to kind of get a refill. Okay, so now let's talk about the other 2 fillers that I also love, Volure and Volbella. Volure is also a lip filler and a lip plumper. It also is made of hyaluronic acid, but it's slightly different family in the sense that it doesn't cause as much swelling post treatment. So the first 48 hours you won't have as much swelling, but it does give a little more fullness to the lip. So for long-term fullness, that is slightly on the higher side, Volure is great. It also lasts a little bit longer. So with these, I usually say around 6 months or so. These would, the Volure would probably last you around 9 months or so. So I love this filler too. So for someone who wants quite a lot of fullness to the lip, but wants a natural look and doesn't want early on swelling, I love Volure. Okay, and then the last one is Volbella. This is also a hyaluronic acid filler, but it is much thinner and finer. So it is not for lip plumping, but it's more for lip smoothing. So if you want the fine wrinkles on the lip to be smoother, Volbella is great. So it's more of a lip gloss effect. So it gives smoothness to the lip area. So for a young person who wants smoothing, who really does not want any fullness to the lip, Volbella is great. The other area Volbella is really great is for older women or someone may not be older, but they have a lot of lip lines. So what I mean is the vertical lines that go above and below the lip. I think Volbella is an amazing treatment for that. Because generally when someone comes in with lip lines, I do an injection of Volbella along the lip border, that's the vermilion border, to give a mild fullness and crispness to that area. And then I go after each of the lip lines and inject Volbella in the lip lines. So this is an amazing treatment for lip lines because it does not give the lumpiness or bumpiness that some of the other thicker fillers may do. So this is where this fills a really nice niche in the lip treatment market.